So I asked Rebecca want to be a discussion, but she preferred just to introduce her association, foundation. So let me hear what Rebecca say. Thank you.
Thank you, President Tian, and ladies and gentlemen. It's my honor to share with you the NCF stories. And I think besides officers, just, the government sector always think about diplomacy. I think NGO sector always think about humanity. And then the story from here. He is the founder of Craniofacial Foundation, and he's American and surgeon. In 1959, arrived in Taiwan, and this time Taiwan was very poor and lack of the medical resources. But he came to Taiwan to establish many first medical center, medical system, such as ICU, brand new craniofacial center. And in 1990, he donated his saving $100,000 US to establish Craniofacial Foundation. Here, 1959, he came here as a medical missionary and spent 1 month to take the ship, arrive Hong Kong and fly to Taiwan. Yeah, and you can see the pedicab in the street of Taiwan. Okay, and he did a lot of contributions to Taiwan, but I think the most important contribution is to train the local professionals in preventing better medical standards in Taiwan, which means he supported many Taiwan medical personnel to stays to Europe to study advanced technique. Then those medical professionals came back to Taiwan to promote medical standards in Taiwan. And I think it's a very successful Taiwan model, and we'd like to share this successful model with the other countries. So it's the Dr. Nodo, just 19. He stayed in Taiwan for 40 years, and he can speak Taiwanese, not Mandarin. And retired from Taiwan 1999, but he still support our medical teams around the world. You can see that in 2009, he saw patients in Philippines. And it's the purposes of Craniofacial Foundation. We help the indigent patients to receive have comprehensive cares, and to educate the public to accept social acceptance, and to support the research in this area of concern. And in 1998, we started our international care programs. And it's our core value is emphasize the comprehensive care for patients, which means we focus on to take care of patients' psychological scar is as important as his physical scar. And the comprehensive care, which means we emphasize the team approach based treatment. And the team membership should include surgeon, orthodontist, anesthesia, nurse, speech therapy, coordinated social worker. And you can see a very cute twin, but just have lip and palate deformity. And 20 years old, graduate university student. And here's the micro-tear patients, the ear deformity, and after surgery. Yeah, university student. Okay. And it's our result of the domestic service And you can see we from 1999 until now we already have 50,000. Okay, it's our result of domestic, based on the concept of love without borders. 1 hour change one life. We started our international craft service programs, and it's our co-value team approach, capacity building, and teaching a man how to fish is better than giving him a which. And we select the local hospital to deliver the common goals. Then we organize the medical team from Taiwan and to perform the craft mission at the local hospital. Then we will select the medical personnel to Taiwan to get a training. Then after the sea doctors went back to their home country, we will visit the local team once a year to update their technique. And we also link the international resources to help the medical teams growing. And the ultimate goal is to help the local team to operate independently, just establish the local foundation to help the local patients. And here's the result of our international service program. You can see we already provide 83 missions and about 2,000 patients get free surgeries. And we also supported more than 170 medical personnel to Taiwan to get a training around 20 countries. Even the doctors from Uganda and Ghana. Okay, here's the Ghana's doctor. Okay, and now we focus on helping the overseas craniofacial center around 7 countries. They are the president, China, Indonesia, Mongolia, and here's the story about the Cambodian. And now the medical teams can provide about 250 surgeries per year, but before, in 1999, just the patients could not get a surgery because there was no surgeons be able to perform the craft surgeries. So we supported the doctors, the surgeons to Taiwan to get a training. And as the case, this patient came to our team, 3 years older, 5 years older. Now she graduated from the university, from the college, and worked as an assistant of a dental clinic. Okay, and it's a Mongolia story. Okay, and just now they can provide 400 surgeries per year. Before they only can provide less than 100 surgery, the simple surgery. But now they can just organize a medical team now. And the story started from this boy. He could not go to school because he couldn't speak well due to he had cleft palate. And his Taiwanese donors called us to help him. So we arranged a patient to get a surgery at our medical team in China. And just now, the patient went to school very happy. Okay, here's the Mongolian. Okay. To show you, not only the cleft palate patient, but also the craniofacial deformity. Like this patient, he has nose deformity, and the anesthesia equipment in anesthesia machine in Mongolia is the second hand, just donated by Russia and after World War II. So we donated the equipment to to the patient and after the surgery, and it's a Mongolia team, and also the Russia doctors came to Taiwan to get a training. It's the same story in Vietnam, it's in Burma, and Indonesia, and it's Pakistan. And we supported this patient to Taiwan to have surgery. And I think, NGO like NGOs want to develop the international program should keep the several core values in mind, such as the partnership, the effectiveness, the transparency, the ownership, the accountability. Thank you for your attention.
The first session is to show you the capability Taiwan NGO process. And then our second, due to the unfair treatment, unfair status Taiwan is suffering in the international society, Taiwan's NGO are unable to contribute duly to international society. That is the reason for us to have this forum. We hope that second session, led by Chair Professor Lisa Baluch, you will be able to voice your idea and how to connect Taiwan's NGO to African continent. So let's have a 5 minutes break, and then we start 11:35. Okay, thank you.